During the pandemic, being alone and isolated was such a devastating thing for me.
Local artist Mike Duarte, like so many of us, says it's been a rough couple of years.
People just not being able to be so receptive to each other, that definitely took a toll on my mental health.
For many others, the past 2 years of COVID lockdowns and mandates have led to a spike in drug addiction, overdose deaths, and even teen suicides. In fact, between February 21st and March 20th of last year, the CDC says emergency room visits due to suspected suicide attempts among girls ages 12 to 17 were up 51% over the same period in 2019. Carol Hotley says she's seen the impact remote learning has had on her own granddaughter.
My granddaughter last year became a freshman in high school. She missed that whole first year. She didn't turn into a high school student. I would say she's just now catching up with the high school experience. That was very hard on her.
The COVID fatigue is transcending the lifespan.
Dr. Lisa Durrett, an assistant professor of psychiatry at UNLV's Krikorian School of Medicine, says that studies are now being compiled from all over the world, and every age group is feeling the impact of the lockdowns and restrictions.
We're looking at kids like 10 to 17. We're seeing rates of depression reported to be between 22 and 46% in these kids. Anxiety rates between 19 and 37%. Greater than 50% have described a moderate to severe impact of the COVID pandemic on their mental health.
Even one of the strongest age groups physically, college students, suffered from the disruption of what they thought would be a traditional college education.
Studies amongst college students are finding that they have had persistent negative effects of the emotional impact of COVID. And they're finding that the impact of COVID itself is persistently causing struggles with depression.
And depression can lead to suicide. That's why Dr. Durrett says it's important to know when you or a family member needs professional help.
So in adults, somebody who's becoming more easily irritated, more easily angered, somebody who's withdrawing, spending excessive hours in bed, not being able to just get up and function, who's withdrawing from friends, who's withdrawing from social contacts.
And the warning signs for children.
A kid who academically is really falling behind, who you suspect is using alcohol or drugs, who's hurting themselves on purpose, either cutting on themselves, talking about death, and really any significant change in mood or behavior is cause to reach out and get help.
And if we've learned anything during the pandemic, it's knowing that help is closer than you might realize.
The COVID pandemic has given us an opportunity to explode the world of telehealth. And so mental health resources, telehealth resources are just within your laptop.
Unfortunately, there still isn't much science yet on when we might see a post-pandemic psychological return to normal.
So do we want to see that happen in the US and in the world? Absolutely. We just don't know when that's going to happen or how that's going to happen.